run. We offer transportation. We also have a Medicare, Medicaid dual plan in 8 counties in New York State. And then we offer a Medicaid managed long-term care program in 48 counties in upstate New York. And I am the regional outreach coordinator. So basically my job is to go out and educate people and make sure they know that there are options if they want to stay living safely in their home and avoid being in a skilled nursing facility.
Great. Kathy.
Hi, everybody. So I am also from the Rochester Finger Lakes chapter in upstate New York. I am a geriatric care manager. I co-own Entrusted Care with my business partner, Gina Donnelly, who's not able to join us today. But we offer care management service in the private sector to anyone who's needing assistance with either moving to a new level of care, managing a crisis, trying to stay at home and get connected to services. We also help people if they need to apply to Medicaid or if they're participating in programs like Megan's Consumer Directed, and we help with that as well. So that's what we do here. Thank you.
Great. It's so much fun having people from all over the place, different points of view. That's really great.
I laughed a little bit when Tara said, "Oh, it's almost 9 a.m." because I'm looking at my clock and I'm like, "No, it's not. It's noon." And then I went, "Oh, right. Time differences."
I can't tell you how many chapter meetings I miss because I don't look at the time difference when I put it on my calendar. I'm going like, well, how come nobody's here? So Robin and Michael, you're our speakers today. Am I correct? Okay.
Correct.
I will introduce myself, then we'll come back to the two of you. My name is Carolyn Novotny. My company is Access to Senior Living, and I do a lot of what Courtney does, except for I don't blog. Never got into that. But I started my business after over 30 years of being a commercial insurance broker because I didn't have a Courtney that I could depend on to try to work things out for my own mother. So I do consulting and helping families walk through the journey and also do some placement. I'm also involved with our local village, and I know the NAIPC has been working with some of the village organizations. And one of the things that we are working toward kicking off this probably first part of next year is a support group for caregivers, because we're all out there scurrying and trying to make a living and also take care of our senior loved ones. So I'm excited that they are working toward that. So Michael and Robin, I will let the two of you introduce yourselves, and I'm going to turn this back over to Tara. And if everybody could mute themselves.
That's perfect. Well, Robin is part of our Long Island chapter, and I'm happy to introduce her to Orange County and the national group. So Robin, I'll let you introduce yourself and Michael, and we'll just get going from there. And if you have any questions, feel free to put them in the Q&A box, and we'll make sure they're all addressed at the end.
Perfect. Thank you so much, Tara. And thank you also to the National Aging in Place Council for this amazing opportunity for us to share our work with you. I actually think that this is going to be very enlightening and innovative. I think it's going to really spark your curiosity, and hopefully we can move together as a group to make it better for those aging in place. But without any further ado, because I know time is of the essence, it gives me great pleasure to welcome our COO, Michael Podiger. Michael, take it away.
Sure. I'm excited to be here with everybody and kind of share some of the work that we're doing in this space. I think it might be helpful before we kind of jump into our solution and talk through kind of the problem that we're trying to solve and how we're going about it. It's just to give you a little bit of background on myself and our team. my background is in software development and IT. So I work for a mobile app development company out of college. And I got into the dementia care space during a project with the Wisconsin Department of Health back in 2018. They were doing some really innovative things in Wisconsin, and one of those was they were deploying tablets in communities that were providing dementia care to try to personalize engagement activities. And I was the IT guy on the project. I was the guy in charge of setting up all the tablets and making sure that they work properly. But I really latched on to this particular opportunity because dementia was impacting someone in my family, and I just had this opportunity to connect with all of these experts in the field through this project. So I became really involved. And on one level, the project was successful because we had all these super inspiring anecdotes of people in nursing homes using the tablets, the staff using the tablet in creative ways to connect with residents that were isolated and withdrawn. So we had all of these touching anecdotes, but kind of big picture, there were lots of limitations. The staffing ratios in the nursing homes made it really tough to do the individualized engagement. On a technical level, there was no hub for the information to personalize the engagement activities for the residents. And there was no way to get families involved and maintain HIPAA compliance. And then on the research level, because we were working with a research institution, we were collecting data. That was extremely difficult to do. It was a high administrative burden. So you had these caregivers that already had a lot of responsibilities, and now they were being asked to chart all of this data. So there was a real high admin cost. So to make a long story short, over the next few years, some of my colleagues on that project became my teammates. And we started to address some of the challenges we encountered on that initial project. So the first thing that we did was we kind of took this idea of using technology to personalize dementia care, and we focused on the home care setting, which was better suited for the individualized engagement. On the technical side, we began prototyping a mobile app, which I'm going to show you today, to involve families in dementia care engagement. And then on the research level, we partnered with researchers at the University of Wisconsin to integrate assessments and make it easier to collect data on outcomes. And that eventually led to an innovation grant from the National Institute of Health that we're currently in the middle of. So today, I'm going to just share a high-level overview of the problem we're trying to solve, show you how we're doing it by giving you a little demo of the app, and then provide a case study to kind of explain how this works in the field. And I'd love to wrap up early so we have plenty of time for Q&A and conversation, because I think that's usually when some of the best insights and discussion emerge. So I'm going to share my screen. Can everybody see my desktop? And you should
Yes,
see.
we can, Michael. While Michael's sharing his screen, I'll just share with everyone here that I've worked in the field of working with dementia and dementia care for 30 years. And I've seen the pain points that are out there in the field and the practice. And when I saw what Generation Connect was doing, I knew that this was a gift. So that's all I'm going to say right now. I'm honored to be part.
Well, I'll start by just really kind of digging into the specific problem we're trying to solve. And I think many of you are going to be very familiar with this because of your background in aging. What we're really looking to do is slow this cycle of what we define it as the dementia care loop or doom loop. And there's a few components to this. When somebody is living with dementia and they're experiencing memory loss, it becomes a barrier to connection and purpose in their life. it can be harder to interact with the people you love. It can be harder to engage in activities that you've done your entire life. So this barrier oftentimes results in people feeling upset or frustrated or anxious or confused. And ultimately, when somebody's feeling upset or sad or bored, that's going to lead to some care challenges, whether that's a person refusing respite care, whether it's them getting verbally or physically aggressive or wandering. And what happens is, as somebody progresses through the stages of dementia, this loop accelerates. So in the early stages, the kids might not call as often because mom keeps repeating herself, and it's harder to maintain a conversation on the phone, and that makes mom feel a little bit anxious. Well, eventually the symptoms progress to the point where you have to take away mom's keys, and now she can't go to her church outings or go to the grocery store, which gave her kind of a purpose and made her feel like herself. And in the latter stages, even just simple communication becomes more challenging. So this loop accelerates over time. And the way that we saw this impacting the market, most people that are living with dementia, we know the statistics on this. They want to stay at home as long as possible. But usually aging in place follows a pretty predictable pattern for people living with dementia, based on some of the data that we have from our home care partners and some studies that have been conducted. And in the early stages, symptoms are pretty manageable, and people with dementia become really good at masking symptoms. For those of you that have gone through this with a family member, you've probably experienced that dynamic of masking. And family members want to believe everything is okay. So typically in the early stages, they kind of carry on as normal, despite some red flags here and there. Now, often there's some type of event. Mom goes to the store and she gets lost. She can't find her car, or maybe she gets into a car accident. And that event triggers families to explore options for respite care or home care. But oftentimes, the care recipient might be a little resistant. He or she doesn't like the idea of having strangers in her home. They think they can manage on their own. So it becomes really stressful for the family to coordinate. And eventually it becomes so stressful that they decide to move their parent into assisted living facility or a nursing home. And sometimes, that can make the situation worse. If someone wants more autonomy and control, and they're having to move against their own will, that can sometimes accelerate some of those behavioral and psychological symptoms that we talked about and result in some healthcare challenges and, overall greater healthcare expense. And what we've been able to do with the help of some of our home care partners is chart a little bit of a different path for people with dementia and their families. And it really starts with early intervention. Providing people that are living with dementia and their families with respite care and support earlier in the progression of the disease, with a real focus on the caregiver relationship and helping the person with dementia stay socially and cognitively active. There are a lot of strengths that people with dementia maintain, throughout the progression of the disease, and helping these teams really lean into those strengths. So part of that process was the development of the Generation Connect app, which we're going to give you an overview here in a second. And it really is a tool for family members, whether they're nearby or far away, to kind of stay involved and connected in the social side of caregiving. The app encourages the adoption of a lot of best practices, routines and rituals that have been shown to decrease the behavioral and psychological symptoms. So things like integrating personalized music into daily routines, reminiscing, just moderate physical activity, spiritual practices, just things that have been shown to really help manage some of those troubling symptoms. And it also provides a tool for the formal caregivers to monitor symptoms and burden, which is going to help inform care planning and different engagement techniques. So let's take a closer look at how it works. We designed the Generation Connect app as a digital therapeutic, and it's designed to proactively treat behavioral and psychological symptoms of dementia. So there are three primary components. There's a mobile app that widens the care circle by involving families and friends in social engagement while maintaining HIPAA compliance. That's a big component of this. It allows professional caregivers and family caregivers to collaborate through a HIPAA compliant channel. The second component is a customized tablet that is stationed in the care recipient's home. It's really designed for the frontline caregivers, and it prompts them to integrate personalized interventions into the care plan. You know, listening to music as you prepare lunch, or going on a walk in the afternoon right before sunset. And those prompts can be customized based on the care setting, the stage of dementia, other clinical factors. And then finally, we have some built-in assessments that help capture outcomes, which are going to inform both the care planning on the clinical level, but also some of the engagement strategies. So I want to kind of demo and show you how the app works. So the family-facing mobile app, this is kind of central to the approach. When we set up a care recipient in the program, we send invites to the family members to download this app. And the app intelligently prompts them to share photos, music suggestions, and topics for reminiscence. And what we always explain, you know, part of our secret sauce is the way that we're prompting people to contribute is going to depend on who they are. So the app gets to know the family members a little bit. How are you related to Jane? Do you live close by or do you live far away? And then depending on the information that we collect, we send just little notifications or emails asking family members to share photos with descriptive captions, share topics that are meaningful to the care recipient's life, share music preferences that we can make part of the day to make time spent together more enjoyable. And all of this content aggregates in a feed that's accessible to the formal caregivers. So this content syncs in real time to a tablet that's stationed in the home. And the app is prompting formal caregivers to use the content. I mean, for lack of a better description, it's saying, hey, Jane's son just uploaded some pictures. Why don't you show them to her and read the captions? It's also checking in with caregivers to figure out what's working. If a particular activity is successful. So let's say Jane's son shared some photos. The caregivers can say, hey, we looked at these photos together and she loves seeing the great grandkids. She's excited for the next time they visit. And then that update's going to sync to the feed so that the family can see, hey, these pictures that we're sharing, they're helping out the caregivers. We also check in about once a week and prompt the caregivers to let us know, you know, of these behavioral interventions that we're trying. So let's say music. Is it something that we're doing this week? Yes. How frequently are we doing it? We're doing it often. And then what are we doing when we're listening to music? Is it something that's part of activities of daily living, or is it just kind of a social routine? And then we're really encouraging these caregivers to establish habits, routines, rituals that are going to really become a standard of care, a personalized standard of care for the individual. And then the final component is tracking clinical outcomes. And this has been a big part of our team's approach. I mentioned earlier, we had some funding from the National Institute of Health to really expand the scope of what we were doing by integrating clinically validated assessments. And this is pretty critical to our mission. We really feel strongly about the research component of using technology, and we want to make it easier for providers to demonstrate outcomes. And that starts for us with tracking really two types of outcomes. One is going to be more related to the client's behavioral symptoms, agitation, aggression, anxiety, depressive symptoms. And the other is going to be, how do the client's symptoms impact caregivers? So me as a caregiver, how does Jane's distress or agitation change my experience as a caregiver? So we've integrated some of these tools so that we can track some of these outcomes over time while we're implementing some of these solutions. And we feel strongly about the importance of the caregiver. That's why many of our ongoing research projects are focused on caregiver outcomes. If you can make that experience of providing care more enjoyable and help caregivers feel more fulfilled in their role, that's going to really impact the effect of any type of therapeutic engagement. Because if I'm a caregiver and I feel stressed and I feel helpless, that's going to heighten the feelings of anxiety or anger for the person with dementia. But on the other hand, if I'm a caregiver and I feel in control and I feel kind of at peace, I'm going to have an energy that's also going to kind of add to that therapeutic effect of whatever interventions that we're utilizing. So now that I kind of walked through the
Michael,
yes.
I just have 3 quick additions to this because I think it's important. Michael and I, when we were preparing this presentation, a lot of us are dealing with situations like quality assurance and joint commission surveys, et cetera, et cetera. A lot of this quick, easy, in real-time data is available to you without having to search for it or find it. And that to me is very ingenious and also very creative. I think it's intuitive. It's very productive. It creates a greater workflow. Then 2 other points I want to make is that we don't need a specific tablet. We're very tablet agnostic or device agnostic. So any iOS or Android device is fine. If a person has a tablet, we don't own the tablets per se. So I think that's also important. It also has a voice capture feature, which I love if you're a caseworker or a case manager. So you don't have to type anything in. You could just talk and it'll absolutely capture your voice and put it in as data you can cut and paste kind of thing. And it's kind of exciting. So those are 3.
Robin, I'll add one caveat. We are device agnostic. We can run this software on any device. But when we're working with healthcare companies, whether that's a non-medical home care company or working with a variety of different healthcare companies that serve seniors, we suggest that the healthcare company owns a tablet and we configure it with HIPAA compliant settings versus using a client's personal device. There's just some privacy issues there. So we typically suggest that the healthcare company owns the hardware and then we manage it to ensure HIPAA compliance. I'm going to transition here and just talk through a quick case study, and then I'd love to open it up for some Q&A. This is one of our first ever case studies, and it's a great example of the impact this solution can have on caregivers and the clients that they serve. So we piloted this solution with a home care company that's really a leader in the space. This company serves about 350 seniors locally across a few counties. And they reached out to us. They wanted to leverage technology to improve outcomes for their clients. And they had two goals. We wanted to reduce caregiver turnover related to dementia care, and we wanted to differentiate our services. All of our competitors do ADLs, bathing, meal prep, transferring, but we want to go above and beyond that. So this was one of our first ever clients that we set up in the Generation Connect app. And the owner of the home care company said it's the most challenging client of her 20 plus year career in home care. This individual had advanced dementia. He had a movement disorder that made speaking difficulty. He was suffering from hallucinations. There was a long history of verbal and physical abuse, high caregiver turnover. The family was really frustrated and really felt hopeless and helpless in this situation. So they started to provide care for this client in 2014, but they discontinued services with him because of behaviors. They re-engaged with the client to supplement the care he was receiving in the assisted living facility in 2015. From 2015 to 2016, he was removed from multiple facilities because of behaviors and was forced back in the home. The daughter reached out to the home care company and said, "Hey, you're my last resort. I don't know what else to do." So in the fall of 2016, the home care company started providing services again. Eventually, it was 24/7 care, but it just wasn't sustainable. There were 75 caregivers removed from this case because of physical and verbal aggression. And this is about the time we got involved. And we were really able to get some awesome outcomes with this particular case. And a lot of the credit goes towards the daughter. She became very hands-on in helping us to try some new and creative ways of engaging with her father. We found there were a few aspects of engagement that really helped curb behaviors. So one was watching YouTube videos about heavy machinery. This individual was a foreman at a manufacturing plant of bulldozers and cranes. And we found a series of videos on YouTube that he just loved watching. And that became part of his daily routine, was watching those videos. Music was another big component. There were a few musicians and bands he really enjoyed. And we built a series of playlists and had some live concerts that were integrated in the care plan. And we also, there was a nighttime prayer routine that he did with his caregivers. And there ended up being a dramatic decrease in behavioral incident reports. Prior to introducing the engagement platform, there were 27 formal reports of physical or verbal aggression. After we introduced the engagement platform, there were only 3, and there was substantially less turnover. So prior to introducing the solution, there were 75 caregivers that came and went on the case. After introducing the solution, that was decreased to 10. And the volume of care was the same as in terms of the amount of hours. So there was about $190,000 worth of care provided prior to introducing the tablet over the course of several years. In the last year of his life, he received 24/7 care, which resulted in $187,000 of revenue, but was substantially less turnover. So hopefully that's a helpful example of showing how this can make a pretty significant impact, kind of at multiple levels, on the family level, for the frontline care workers, and also for the home care business, and just being able to reduce that churn, which can be really costly for small businesses providing in-home care. So that was a lot of information, I know. I would love at this point to just turn it over to the group and see if there's any questions, and just start a discussion.
Oh gosh, thank you so much for that information. This presentation kind of piggybacks and reinforces what we learned in the Gifts of Dementia presentation with Judy Cornish about finding what dementia patients respond to and highlighting that, and really encouraging them to find their gifts. So that's great. I'm curious, since you're tracking caregiver burnout, what are some of the top reasons that you found for caregiver burnout generally?
Well, I will let Robin handle this. Robin has a lot more experience on the front lines. I did want to mention, I'm a big fan of Judy Cornish, read both her books, and
Yeah.
I've gifted them to many people that are going through this. And yeah, a lot of the principles that that she explains, we've integrated into our solution. But from my experience, the top reasons I've seen for caregiver burnout is, especially in the home care industry, is this feeling of isolation. They're in the home with the client, taking on really challenging situations, and whether they're experiencing wins, where they're doing things that help the client, or they're experiencing challenging situations in the home care environment. Sometimes you don't have anybody to share that with or connect with on that, so that can be really tough. That it can be a really not only difficult emotionally, physically, but it can also be an isolating role too. Robin, I'm sure you can add on to that, because you have a lot more experience in a lot of different care settings.
Well, having been through COVID in assisted living as a director, I will share that one of the biggest problems that we had, I mean, COVID really has given wings to the back of what we're doing here with Generation Connect. But I saw so many caregivers, who had sat through numerous hours of training, but that didn't necessarily translate in real time. And so they would come out of the rooms being frustrated because the resident was supposed to remain in their room, and they needed a tool in their toolbox that helped them on the spot. And so if you have something like this that creates this where you're able to curate a personal, medical narrative or autobiographical narrative of the person, it's an easy fix. It's like, let's go to the music. I love to go back to that screen that Michael showed, where all the different elements that are curated. It's not just music. It's moments where they have, again, it could be videos, or it could be a situation where there's a picture, or they went to a museum together somewhere, or a wedding picture, whatever it is. And it really has a unique effect on the individual that you're taking care of, or that you're partnering with in care. And I think this is a nice puzzle piece that's missing, and it's missing on a number of different levels. It's missing in a lot of the new digital therapeutic devices. It's about medicine and making sure the person takes the medicine and getting them to place them, but it doesn't really talk about the personhood of the person. And when you can engage in the personhood of the person and honor that personhood, that caregiver feels wonderful. They put their head on the pillow at night and feel good about what they do. And they can say, I made a difference in Mr. Smith's life today. I feel really good about this. I've seen my first love is always to the person with dementia, but I'm just really want to support that caregiver, because they're very underpaid, underappreciated, and they work so hard at what they do, and they're very passionate. So the having that actual tool to utilize in their pocket, at their, whenever it's needed, to me is, like I said in the beginning, coming full circle, truly a gift.
I was just sharing a slide that shows some of the different categories of engagement that.
I have a question. Can
Sure.
a family purchase this app if the community or the home care company does not want to participate, but the family wants to have it available as a tool?
Yes. So right now, we're creating a wait list of families that want to use this where the primary caregiver is a family member. So a lot of the research that we've done to date, all of the research that we've done to date has been in a home care environment or in a nursing home. But we have some pending funding to support family caregivers. And it's really our goal is to go direct to families. So to answer your question, today, no, but within the next few months, we are creating a waiting list of families that would want to use this solution and start building their profile for their loved ones that we will be reaching out to them and making the platform available to a group of early adopters to start using this before they are formally working with a respite care provider or community.
And can you put your information in chat so that if someone wants to be on your waiting list, they know how to contact you?
Absolutely, yeah, we can do that.
And I also, Tara asked Michael for us to send the slides, so
Okay, yeah, we can do that.
you can do that.
Yeah, I wish it was ready. We're like 2 weeks away from redoing our website with a lot of this information on there. So we will share the existing stuff, and for anybody that's interested, we'll send out once we've made some of those updates as well.
Great.
I have a similar question to Carolyn. First of all, kudos to you all for creating this. This has been needed for so long. Thank you. I'm extremely excited. I wish we'd had this. In the 11 years I was in a CCRC, I was on the nursing care floor working with Alzheimer's and dementia patients. And the number of families that just wanted to know what they did each day, and it's hard I was the activities director sharing all that. I just think it's great. But my next question, now that I'm working mostly with people that are staying in homes that are mentally and physically much more able to do on their own, will y'all be creating anytime soon an app for family caregivers of just the higher functioning seniors that they just want to check in and make sure they made it to the doctor's appointment, that they took their medicine today, that they remember they took the trash out, that kind of thing? Is there something like that in the near future?
Yeah, we like to stay open-minded to different opportunities in the field, but when I look at the technology landscape for caregivers, that space that you're talking about, there are some tools out there right now that exist on more of what I would consider care coordination.
Mm-hmm.
There are a lot of companies that are trying to solve that problem. And we saw a real maybe lack of solutions that were trying to solve the treatment of dementia symptoms. So what you're describing is care coordination platform. I think there's some neat ones out there. I would be even happy to name some. Have you ever heard of care.ly? CAR.ly? It's a care coordination app. It's free. Really well done. But we're really focused on kind of being a digital therapeutic for now, and starting with dementia. But I do think there are applications to non-pharma behavioral treatments for other conditions. So a lot of the things that we talk about, socialization, reminiscing, purpose-driven activities, that's going to be especially helpful for people with dementia, but it could also be helpful for seniors that are dealing with some other physical and cognitive health challenges. So I think we're more focused on the digital therapeutic side of things as opposed to care coordination, but I'd encourage you to kind of see what's out there because there's some cool stuff happening in that space too.
That's great to know. I was just very impressed with y'all's product and I think it's great. And thank you for creating it. I just didn't know if you're going to keep on. Just
keeping on.
Yeah.
The hardest thing for us is picking the stuff to build because there's so much need and so much opportunity out there. I feel like this space is very underserved when it comes to technology to help out caregivers.
Absolutely.
One of the reasons why I totally fell in love with this company when I first saw the product was because just knowing that I'm dovetailing exactly off of what you were saying, Courtney, because it was missing. This is what was missing, that narrative care plan. Because especially when somebody moves from place to place, how many times have I heard family members say, I filled out 6 forms that said the same thing. Don't you know anything about my father? Don't you know that what his native language is? Don't you know this already? But they don't know those pieces are missing out of the care plan often. And those are, I believe, the most important pieces, because how do you reach a person unless you know about who they are, or a little bit about who they are and what they are, especially, from a recreation point of view too. It's crucially important to understand the person as a whole.
Great. Well, we'll see. Do we have any other questions before we wrap up? This was great. Thank you for the information and the presentation. And maybe we'll come back and have another session on care coordination platforms. I would be interested in that as well. So.
Oh, totally. I can, Tara, that was just like off the top of my head, but there are a couple out there. I can just shoot you a link to a few that might be worth poking around.
I love that. That would be great. Maybe that's what your panel discussion can be, Courtney. Courtney and I have been talking about her leading a national panel, so maybe that's it. Great. Well, thank you all for joining us today. I just want to wrap up and tell you a few more events that are coming our way in September. Next Wednesday, the 22nd, I am sharing with you my personal speaking coach. She is new, Lisa Reed. She is going to talk about how to increase your business through speaking. So she'll be a great one just on the personal development side. The Wednesday after that, on the 29th, we're talking with a nonprofit organization on brain health and how to keep your brain healthy as you age. And then in October is our big Aging in Place Week 2021. So we've got a lot of activities going on the national level. I know some chapters are doing things locally, but nationally we're doing a Hidden Gems of Aging series to kick off the week on Monday. And we have a great closing presentation on Friday that incorporates music therapy into caregiving. So the Comfort Care head music therapist, his name is Steve Toll. He is going to be talking about including music in your care with seniors. And he also has a live podcast that he does every day at 1:00 that he is creating a special little playlist for us at NAIPC. So that's awesome. And Nita, I know you have a music therapy background, so that's great. I saw some things coming in. I think they were asking for background or contact information. So if you have not put your contact information in the chat box, please do so. And be sure to save your chat before you leave. And I will see you guys, hopefully at some, and ladies, at some of the future events we have coming up. So thanks for joining us today.
And I also want to thank Tara for putting this together on the national level. It helps us at the local level. We're running out of a little bit of steam. So thank you, Tara, for doing this.
Well, and thank you, Robin and Michael, for sharing with us. This was great.
Okay, I'm just putting one more thing in the chat box for everyone.